This is Boomer Life on CL 650.
Welcome back to the program. I'm Sterling Fox, joined in studio by Dr. Chris Coburn from Falls Creek Healthcare Center in downtown Vancouver. Dr. Coburn is a laparoscopic surgeon, which means he works on people's tummies. Is that that's a pretty sort of generic way of approaching your craft, is it not?
Yeah, I'm a general surgeon by training, but the majority of surgery we do is laparoscopic, and what that's called minimally invasive or keyhole surgery.
Okay.
The ability to do fairly significant operations within the abdominal cavity and yet make tiny little incisions and instruments to do that.
And of course, with people's, with that area of the body, you don't want a lot of scarring and that sort of thing either, do you?
Well, I mean, typically operating on the obese patient is a high-risk operation. Because when you make a big incision, they have trouble breathing and there can be sorts of complications. The advantage of the lap band, the sleeve, these types of procedures is that we don't make those big incisions.
Right.
And these procedures are taking us half an hour or 45 minutes to do. You're going home from the hospital generally the same day. And because there's no big incisions, you don't have the pain and you don't have the prolonged recovery that you do with more traditional operations.
Okay, I want to find out about each of these procedures. But just before we do, if you don't mind, Dr. Coburn, please, you've mentioned diabetes. And I think most of us understand that diabetes is almost hand in glove with being overweight. If you're an overweight person, you pretty high risk to get diabetes. So if you would, please, what is diabetes and how do you get it?
Okay, so we'll talk specifically about type 2 diabetes. There are two types.
Right.
Type 1 is the type that typically occurs in much younger people, but type 2 diabetes is directly associated with weight, with BMI, as we talked about a minute ago, but mostly with weight. And what happens is as people gain weight, their bodies become resistant to their own insulin. And insulin's function in the body is to take sugar that's in the bloodstream and put it in the cells. I mean, turn it into fat, but put it in the cells.
Okay.
And when your body becomes resistant to insulin, it's not as effective at doing that. So you have higher sugar levels in your blood, which can lead to all sorts of long-term complications with cardiovascular disease and infections and kidney disease and eye disease and so on and so forth. So we recognize the complications of diabetes. We recognize that 90% of people with type 2 diabetes, adult onset or obesity-related diabetes, 90% of those people are overweight or obese.
Interesting.
But what's less well recognized is that although increasing weight increases the risk of developing diabetes, we know very well that if you can get weight back down to a more reasonable level, or at least be in the process of losing weight, that we can put diabetes into what we call remission.
Right, okay.
Remission meaning not having the complications of diabetes,
not having to take
treatment.
pills
Right.
and all that kind of stuff.
So now, if
so, is it? I mean, some people will say, "Well, you know, you kind of brought it on yourself. It's you shot yourself in the foot. Way to go."
Yeah. No, I think that whole feeling around type 2 diabetes and around obesity is dated. We now have very good understanding of the physiology of obesity, what causes it, and it's a very complex disease. I don't mean to belittle it at all, but it's very complex. But individuals who are overweight, it's not as simple as stop eating. They just can't do that. And it's no more than we tell somebody who's diabetic, don't be diabetic anymore.
Yeah, right.
You can't do that.
Good luck.
Right?
Right.
Yeah. So we have to have compassion and understanding for the disease of obesity, but we also have to put in place some opportunities or some ways to treat it. And diabetes is an epidemic in society now.
Absolutely. Yeah.
And
This is why I'm grateful that you're patient enough with me to take a moment to talk about that as it applies to any person who's overweight to any extent.
Absolutely. Yeah.
Okay. Now, with respect to these surgical procedures, these laparoscopic procedures, what was the very first one? When going back to when people decided, well, there's got to be another way. I don't want to run. I don't like bicycling.
Right.
I can cut back on my food, but it doesn't seem to be doing the trick. So I got to get something surgically altered. What was the first thing people did?
Well, there were some ancient sort of operations that were not very popular, didn't work very well, and are abandoned. Probably the first widely used procedure was a stapling of the stomach called a vertical banded gastroplasty, or VBG, widely popularized by Dr. Mason in Ohio. Number were done across Canada. Unfortunately, it was a big operation with complications, and the majority of patients did not sustain the weight loss. The next operation to come along was a gastric bypass.
I've heard of that one.
Yes.
Okay.
So this is the most commonly publicly funded procedure now in Canada.
They
It's done
still
in
do them then?
hospitals. Yes,
Okay.
absolutely. Yeah, no, do fairly large volumes. And in a gastric bypass, what happens is the stomach is actually divided, leaving a little bit of the very top of the stomach is separated from the rest of the stomach. And that little pouch, and I'm going to use that word a lot as we describe the procedures, that pouch is joined up to about half of the small intestine. And the small intestine is where you absorb your nutrients.
Okay.
So the gastric bypass works because you have a smaller volume, you eat a smaller portion, but also it passes through a shorter section of the intestine, leading to less absorption of nutrients.
Oh.
So,
So if you do that procedure, you are perhaps subjecting yourself to lack of certain important foods or nutrients.
yeah, you may. And now the gastric bypass patients will typically take supplements in the way of proteins and vitamins
okay.
and minerals and so
Right.
on to make up for that malabsorption, because the malabsorption of carbohydrates and fats may be a good thing, and that's where the weight loss comes. The issue with a gastric bypass is that it's not an adjustable, controllable, or reversible procedure. Once it's done, we can't go back and alter it really in any way. Patients who have a gastric bypass tend to lose a lot of weight, at least initially, but there's unfortunately about 30% who may regain weight after about 3 years. And again, there's nothing we can do about that.
Interesting. So would the next step in the evolution of tummy tucks and all of that sort of thing, would that be the lap band then?
Yeah, so the lap band was
And
introduced.
you sort of turned your nose up when I said tummy tuck.
Well, because it's not a weight loss operation.
Oh,
Tummy tucks is a cosmetic procedure, but
and
it's not a weight loss
it's an
operation.
entirely different
Oh, yeah.
thing then,
Yeah,
isn't
it's
it?
done by cosmetic surgeons, and it's used to sort of tighten abdominal muscles, typically in women who may have had pregnancy and so on.
Okay.
But it's not, and it's a big misconception that liposuction and tummy tucks are weight loss operations. They're not.
Well, I'm glad I kind of stumbled and threw it onto the table inadvertently, because now you have a chance to clarify that.
Yeah. So they're operations done for cosmetic reasons.
Okay.
Unfortunately, some people are under the impression they're weight loss operations, but they're not.
Okay.
I've seen lots of people who have them and then just gain the weight back, and it's been unfortunate.
Okay, so talk to us about a procedure that is definitely
Right.
all about weight loss,
loss.
and that's the lap band.
Yeah, lap band or laparoscopic adjustable gastric band procedure was initially performed in the late 80s in Europe, caught on in Europe and Australia, but but really took off in 2001 when it was licensed or approved in the United States. Now, the lap band procedure, what it involves is, again, a laparoscopic procedure, so no big operation. We put people to sleep. We look inside with a little telescope, and we put this band around the very upper part of the stomach, leaving a pouch, small bit of stomach, maybe the size of your thumb, above the band.
Okay.
And the way this procedure works is when individuals eat, each bite of food comes down and it gets held up by the band. So that little pouch of food fills up, and the filling of that little pouch starts sending signals to your brain. And your brain thinks that there's food all the way to the top of the stomach.
This is the beginning of tricking yourself.
Yeah, tricking, or just at least, allowing your brain to be stimulated and be given the impression that you've eaten a much larger portion than you have.
When you undertake this procedure, I would imagine, and we'll talk about the warm-up and the preamble to receiving, I would assume then the patient is completely aware of what's about to happen to him or her.
Oh, critical. So critical to, any surgical procedure, but certainly from a Smart Shapes point of view, I think one of the things that I'm most proud of with our team and our staff is our ability to educate people, select people, but educate people ahead of time about exactly what they have to do to make this procedure successful.
Okay.
Because it's not magic. We describe the lap band as a tool, and the tool, again, that allows them to feel satisfied with a smaller portion. But back to the band, once that bite of food passes across the banded area, it now travels down through the stomach and the bowel normally. So there's no change whatsoever to digestion or absorption. You don't need all the supplements that you do with a gastric bypass.
So you really haven't altered anything.
No.
All you've done is just put a small collar, if you will, around the tube leading into the stomach. There's
Correct.
no cutting or nothing else is done.
No, No. So therefore, it's a simple procedure, and therefore it's a very safe procedure. That it doesn't involve the risk of things not healing properly or leaking like you can with a gastric bypass.
Is this what Chris Christie had?
Correct. Yep.
Okay.
Rex Ryan, Chris Christie. New Jersey was a popular place for the lap band a few years ago.
Oh, okay.
So yes. But the very unique thing about the lap band, there's a bunch of them. One of them is that on the inside of the band, there's an inflatable area that we call the balloon. And that balloon, so the band itself is connected by tubing to a little port, and the port is the part we put under the skin, under the fat. If in fact food is traveling across the narrowing caused by the band too easily, and not enough of that signaling is going to the brain, then you just simply visit the clinic, Falls Creek, or we have centers all across the country, where a small needle is placed through the skin, fluid is injected into the port, which fills the balloon on the inside of the band and makes it a little bit tighter.
And restricts the opening there.
Yeah.
Okay.
So it makes it a little bit tighter, and therefore, as it's tighter, the food travels through a little more slowly.
Right.
More of those signals are sent to your brain, and so individuals start to feel satisfied with smaller and smaller portions over time. And so they lose weight in steps. They'll lose weight for a period of time, hit a plateau, get the band adjusted down to the next level. So you keep going down in these steps until you get down to where you're comfortable, where you think your health needs have been met, you feel good about the way you look, the way you feel, the way you're moving, and so on. Forget about the number of pounds on the scale. Again, back to the concept of non-scale victories. And once you get down to that level, leave it as it is. We leave the band in place, and it stays in forever.
Okay.
All right? If we ever did take the band out, which can be done, again, the advantage of this procedure is that the lap band is reversible.
Okay.
So about 2% of our patients will, at some point, maybe choose to have it removed, or maybe they develop some other health issue, and the band has to be removed because they don't need a weight loss operation anymore.
Okay.
It's a very simple procedure to take the band out, but once you do that, individuals are at risk for putting the weight back on again because they've had no long-term effect from the band once it's been removed.
Okay, so in terms of the ability of the individual to know how quickly or the rate at which the food is squeezing through the band area and requiring, therefore, maybe a little tightening. Do you feel that as the person who's had the procedure, or how do you know that it may need a little tweaking?
So this brings up the importance of a follow-up program. Okay, that the lap band, as I've said before, is a tool. And then what we have at SmartShape is a dedicated team of individuals and professionals across the country who work with our patients, talking with them, counseling them, helping them to learn how to adjust with the band and use the band properly, and adjusting it when they need it. And that follow-up program is critical to the success with this procedure. It does not work without it. If people end up going out of country and getting a band somewhere and don't get that follow-up program or that follow-up care, they're not going to have success.
We've heard about this. I mean, Mexico has been, you see all sorts of stuff in the papers about people buzzing off to Mexico for all sorts of procedures at bargain basement rates. And generally the old adage, you get what you pay for, ends up, the cows come home on that one, don't they?
Especially with the lap band. I mean, if you're going down for a one-time procedure, maybe you'll be okay. But the lap band, the operation itself is just one step in the journey.
Right.
And unless patients have access to people like we have at Place in SmartShape where they can get that post-op care, they're not going to get the success and they're going to be disappointed. And that makes me sad when I hear of people who've committed their savings or made this emotional commitment to a procedure, and then don't get what they need to be successful.
Right. Are there procedures in advance at Falls Creek or at any of your SmartShape centers across Canada? How does one become eligible to be operated upon? Is there an evaluation program that's part of the deal as well?
Sure. So anybody who'd be interested, I mean, the majority of our patients get to us through our website. We've got a great comprehensive educational website.
Okay.
You can get to that at www.smartshape.ca or swlc.ca. Both will lead you to the website with a lot of information, and on there, contact information. You send us your information, and you start speaking to our staff. And we've got a team of advisors and helpers that initially just give you the basic education.
Of course, could we do the Vancouver approach to this?
Absolutely.
Could we go to falsecreekhealthcare.com and
Yep.
the links are all there,
there
right, to
too, yep.
SmartShape and all of that sort of thing?
Yep.
So there is an evaluation process. You just can't walk off on the
No.
street and plunk down a bunch of money and say, okay, cut me open. I'm the next.
And again, what makes us unique at SmartShape compared to other clinics around is that every patient who's considering this speaks to one of our surgeons.
Okay.
There's no cost. It's a no obligation, no cost consultation. But we want to talk to people and make sure that they understand what this is all about.
You know, that's kind of a great thing to say on January 10th. Again, if you're sitting there just on kind of sitting on the fence, maybe I'm going to do something in 2015. By George, I'm going to do something. I'm going to weigh less at the end of this year than I did when I started. So here we're just discussing some possibilities, but not everybody is automatically eligible for this stuff.
No, it's important to us that that a patient is healthy enough to be able to undergo these procedures.
Sure, of
although,
course.
as I mentioned, they're very safe. We've completed over 5,000 procedures without any major complications in the way of deaths or infection or bleeding.
Right.
So very safe procedure. So we need to know that they, can have the operation from a physical point of view, and that they're prepared for this and what it involves, the changes they need to make in the way they eat down the road to be successful. That it's not about sales and marketing, it's about success. And that's what really drives our team, is wanting our SmartShape patients to be successful.
Our incredibly timely guest on this episode of Boomer Life is Dr. Chris Coburn, laparoscopic surgeon from Falls Creek Healthcare Center and SmartShape. He's the boss. He's the president of SmartShape. And we're talking about weight loss in the early part of January 2015, and a lot of us are seriously considering this. Some may last longer than the end of January. A lot of us don't quite make it there, but for those who are seriously considering something, whether it's dramatic or but it's got to be purposeful. Boy, are you listening to the right radio program right now. We'll need to take this quick break, and we're back with lots more good information on CIL 650.
Canada's only weekly radio show dedicated to the baby boomer lifestyle. This is Boomer Life on CIL 650.